Today I'd like to talk about BPH. BPH is a condition that men, particularly men over 50, can eventually develop. The prostate gland is a small walnut-shaped gland that sits right behind the bladder in front of the rectum. It is responsible for adding fluid to semen to enhance semen function. As that prostate gland, as a person gets older, the prostate gland can get enlarged, and that's what we call enlarged prostate. But what happens is the urethra, where urine comes out of, goes right through the prostate gland. So if that prostate gets enlarged, it can kind of pinch down, make urination very difficult for a man. Oftentimes a man feels like they need to urinate more often, and when they try, they push, and it's a reduced stream. So it's not dangerous, it's not cancerous, but it can certainly interfere with quality of life and possibly, in a worst case scenario, cause urinary obstruction. So if a person has that, those are the symptoms: difficulty urinating and poor force of stream. Now, what do we do about that? Well, there's medications. These medications help reduce the size of the prostate, relieve the enlargement. I always explain to my patients, it's really a mechanical problem. So sometimes they need a minor surgical intervention, like a roto-rooter that we call a TURP. So basically, urologists will go in there and resect part of that prostate, making it a little bit less constricting on the urethra, and urine usually comes out just fine. So that's kind of the long and short of BPH and what it can cause. I hope that helps clarify BPH.